Good, good. Thank you for explaining that in detail. So you mentioned something now. The absence of cholesterol is incompatible with life. A quick story to that. When I was much younger, I was tiny, a lot tinier than these, and my dad would say, "Well, this guy needs to eat egg, one egg per day, or sometimes he even increase it to two eggs per day." And I didn't know why that could be the solution. But now, when you said, when you said, well, cholesterol is very important to life, and absence of it is incompatible to life. That kind of made me remember that experience when I was growing up. So thank you for
Yeah,
explaining that.
and honestly, there's a couple things to that. So what we see on a blood panel, when you get your cholesterol panel, that's only about 10% of your total body cholesterol because every nucleated cell in your body synthesizes its own cholesterol. Cholesterol is a critical part of cell membranes. It's a precursor for steroidogenic hormones. It's a precursor for bile acid synthesis. 20 to 25% of total body cholesterol is in the brain. So it's very, very important. And so that's why every cell in your body that has a nucleus will synthesize its own. But really, what we see on a blood panel is just the cholesterol in lipoproteins. And lipoproteins are basically mailmen. The ApoB lipoproteins aren't inherently bad, but their job is to be mailmen. And what do the mailmen deliver? Well, triglycerides primarily to the adipocyte and the myocyte, and a few phospholipids, a few fat soluble vitamins. And then what are they supposed to do? Deliver the mail and then go home to the liver at the end of the day. However, if the mailman, instead of delivering their triglyceride packages, start delivering plaquages to your arterial
Yeah.
wall, and the mailmen are bad drivers and they get in a wreck, then, well, some well-intended inflammatory civilians rush to the scene, but in the effort of trying to clean it up, a lot of times they make it worse. And it's that maladaptive immune response that ensues in the arterial wall at the scene of the crime, so to speak, that results in plaque formation and that can subsequently result in clinical events down the line. And so, really, these things aren't necessarily good or bad. It's a matter of if everybody's doing their job and the mailmen are doing their job and they have a good GPS system and they find their way back to the liver at the end of the day, then we're all good. However, there are a lot of factors, especially the home security system elements, that result in these mailmen unfortunately getting lost along the way, and specifically too, if they get caught in a sugar storm, as in people who have diabetes have enhanced risk of cardiovascular disease even when their LDL cholesterol levels appear quote normal. Well, the problem with that is their mailboxes are full because of insulin resistance, and the mailmen are driving around and they get caught in a sugar storm. Anybody who's ever gotten caught in a storm knows how difficult it is when you're in a whiteout and you can't see anything. It's terrifying. And I even lived the song Jesus Take the Wheel at one point because I got caught in a blizzard and my car rolled off into the side of a snowbank. That was terrible. And so anyway, so these things are difficult, and it's no wonder that people with diabetes actually have enhanced risk of cardiovascular disease. If you're caught in sugar storms, then the mailmen probably aren't going to get to their destination. And so anyway, so there's all these factors that result in a traffic jam or a traffic wreck, and we don't want that. And so that's why we need to look at all the things. We don't need to just look at your lipid neighborhood, but we also need to look at those pillars of the home security system. And it's more than just putting in some numbers into a risk calculator. It's about understanding the individual utility of each biomarker and what to do about it for that person. And so that's what I encourage my students and anybody else who I'm talking to evaluate, is understanding each biomarker and what it means and what to potentially do about it. And then with your egg thing, I mean, in general, the cholesterol in food has pretty minimal effect on your blood cholesterol. It'll go a little, maybe, but then there's always exceptions because there are people who are hyper absorbers who they start eating eggs and then their blood cholesterol jumps up a whole bunch. But most people, it doesn't have much of an effect on that, and there are specific reasons for that, and I discuss that in my book, and I'm always happy to discuss what happens when you do eat an egg if people are interested in that.
Yeah, wow, thank you. Thank you for. I like the way you explain things, the analogies and things like that, because when I teach in a class, that's what I try to do with my students. At least those that really want to pass the class, they will pass the class because the way I explain things and the analogies, the examples, the mailman, and things like that, I really appreciate that.